Welcome, and thank you for attending the fourth annual Shared Parenting Council of Connecticut Symposium. My name is Colleen O'Neill, your symposium host and moderator, and I'm honored to be among you today. A little bit about myself. Throughout my career, I've worked in some capacity with victims of violence. I hold a master's degree in education and am a licensed educator in the state of Connecticut, and I'm all too familiar with the effect on our children's education when family dynamics are stressed. I also hold a Master of Social Work degree from Columbia University and am a trained mediator, therapist, social worker, and divorce coach. I successfully implement solutions for divorce mediations and difficult post-divorce issues for parents and children through my private practice, Mediation and Beyond, in Westport, Connecticut. As we are all aware, domestic violence is a global issue and a controversial issue when it comes to family court. Here in Connecticut, thanks to State Representative Alex Kassar, who joins us today, we have groundbreaking domestic violence legislation, House Bill 442, aimed at broadening the scope of domestic violence in family court. The legislative statute that currently exists only recognizes physical abuse. House Bill 442, researched and authored by Representative Kassar, will expand the narrow legal definition of domestic violence in family court law to include and address coercive control, which are non-physical actions such as isolation, intimidation, verbal, emotional, legal, and financial abuse that control a victim. Coercive control, inclusive of psychological abuse, can be just as damaging as physical violence and often escalates to violence when the abuser can no longer control the victim. This bill is also referred to as Jennifer's Law, related to the Jennifer Dulos case in Connecticut, where we can clearly see she was emblematic of a coercive pattern, as are so many other individuals. Again, thank you, Representative Kassar, for this necessary and long overdue change regarding domestic violence and family court. We look forward to watching how this piece of legislation supports divorce and family court issues. We are honored and delighted to have three distinguished panelists today. We have Professor Denise Hines, Associate Professor at George Mason University, who will be speaking regarding research on male victims of domestic violence and the implications for shared parenting. Next, we have Dr. Alexandra Lysova, Assistant Professor in the School of Criminology at Simon Fraser University in British Columbia, Canada, who will speak to us on the Stacked Against Me, Perceptions of Institutional Response to the Incidence of Partner Abuse Involving Men and Their Children. Lastly, we have Dr. William Fabricius, Associate Professor of Psychology at Arizona State University, who will speak to us on new findings regarding domestic violence, parent conflict, parenting time, children's emotional security, and children's stress related to physical and mental health. We are indeed grateful for the distinguished legislators in attendance with us today. We have Senator Saud Anwar representing East Hartford, East Windsor, Ellington, and South Windsor. We have Representative Robin Comey, who joined us last year, representing Branford. Representative Jillian Gilchrist, representing West Hartford. Senator Alex Kassar, representing Greenwich, New Canaan, and Stamford. Representative Nicole Claderis-Ditria, representing Beacon Falls, Derby, and Seymour. Senator Henry Martin, representing Bristol, Harwinton, Plainville, Plymouth, and Thomaston. Senator Derek Slapp, representing Bloomfield, Burlington, Farmington, and West Hartford. Representative Mary Wielander, representing Derby, Orange, and Woodbridge. If there are any legislators that we missed, please raise your hand to be unmuted, and please introduce yourself. Thank you, panelists and legislators, for your participation in such important work. This symposium has been created within a framework of respect, integrity, and grace. We will be continuing here today in that vein throughout our program. With that said, there is some very helpful and necessary information for all in attendance today in order to maintain a smooth flow to our symposium. There's a great deal of information to be shared, comments to be heard, and questions to be asked and responded to. We have 3 experts that we will hear from today. Each speaker will have the floor for 20 minutes, immediately followed by a 10-minute question and answer period pertinent to that speaker's presentation. With respect to and for our state legislators, they will have the first opportunity to make comments or ask questions from our panelists. After the legislators have concluded their time, any additional time will be set aside for attendees to have an opportunity to ask questions of our panelists. If, however, time does not allow to answer all questions after each panelist, we ask that you hold your question to the end of the program, and we will do our best to answer as many questions as we are able to today. While we recognize that each one of your stories matters, we are unfortunately not in a position using this format to hear from each and every one of you. With respect to questions, please be clear, concise, and limit your question to 30 seconds. Questions that go beyond 30 seconds will be muted so we can have an opportunity to respond and to hear from as many individuals as we can. Please make sure that your question is in the form of a question. These guidelines are for us to share this experience in a calm, fair, and informative fashion. There are several options for asking questions during our symposium today. One option is utilizing the Zoom hand raise feature located in the lower right-hand corner of your Zoom window labeled Reactions. Click on Reactions and you will then see the Raise Your Hand feature. Another option to submit your question is in the chat window. You will see the term chat in the lower part of your Zoom window. Click on Chat and type your question in the side panel on the right of your screen. If you are on your cell phone, please click on the term More and proceed to raise your hand. If you would like to practice raising your hand now, please do so. Please note we will lower your hand for you. Are there any questions regarding any of the protocols today? Okay, then as we commence our symposium, I would like to spotlight our first speaker, Dr. Denise Hines. Professor Denise Hines, PhD, is an associate professor in the Department of Social Work, College of Health and Human Services at George Mason University. Dr. Hines' expertise includes the causes, consequences, and prevention of family violence and sexual assault, with a particular focus on under-recognized victims of violence. As the former director of the Massachusetts Family Impact Seminars, she also has a specialization in translating university-based research for policymakers. Professor Denise Hines provides training to domestic violence agencies and court officials, and she has published widely on domestic violence topics. Welcome and thank you, Dr. Hines. The floor is yours.
All right, thank you for that wonderful introduction. And it's a pleasure to be here today to present some of my work to all of you. As mentioned in Colleen's introduction, I do have a special interest in presenting work to policymakers, so it's always a thrill for me to be in front of a policy audience. So the work I'm presenting today is some research that I have been doing for about 15 years now with Emily Douglas, who's now at Montclair State University in New Jersey. And it's on male victims of domestic violence and its implications for shared parenting. This work has been sponsored by 2 of the institutes within the National Institutes of Health. And so what I'd like to get started with is just a disclaimer that acknowledging male survivors of domestic violence doesn't mean that we're ignoring female survivors or downplaying their enormous pain and suffering. I choose to focus today on male survivors because we often don't hear about their experiences, or we often don't even know that they exist. And so I'd like to bring a little bit of their voice to the table. And to just give a little background as related to what I just said, we know that when people and professionals think about domestic violence, they typically think about male perpetrators and female victims. But studies of heterosexual relationships, there's dozens of studies that show a similar pattern, which is that about 50% of violent relationships, both partners are violent to some extent. In about 25%, the male partner only is violent, and in about 25%, the female partner only is violent. So we do know that there is more female violence and male victims than the general public and professionals think about. And even when we also know from studies of people in the general public and from professionals alike, that even when the behaviors are involved are the same, people often think that the female victim is likely to suffer more than a male victim, and that the female perpetrator or the male perpetrator is more responsible for his behavior than a female perpetrator is for hers. So what do we know about how frequently men are victimized by women? Well, we have several population-based studies in the United States that give us some indication. These are listed here. And we see that depending on the study, about 20% to 50% of all partner violence victims in a given year are men. The 20% number comes from the annual National Crime Victimization Survey, which typically conceptualizes partner violence as a criminal behavior, which it is, but most people don't necessarily conceptualize or think about their partner's violence as a criminal act. And so we tend to get very low rates of partner violence when we look at the National Crime Victimization Survey. Higher rates of domestic violence come from the other three surveys that are listed here, which tend to talk about domestic violence in terms of family conflict or safety issues. And the most recent one is the National Intimate Partner and Sexual Violence Survey that comes from the Centers for Disease Control. And they do find that about 50% of partner violence victims in a given year are men. And so whichever way we measure it, whether as a crime or family conflict issue, we are seeing that at least a substantial portion of victims of domestic violence in any given year are men. And yet the research for a long time did not get past arguing about these percentages and whether men truly are victims or not. And so about 15 years ago, Emily Douglas and I decided that we needed to move beyond this argument about whether men exist as victims or not, and to interview these men who say they are victims and learn more about their experiences. And so we conducted two studies that I'll be talking about here today. Actually, Dr. Lysova will be talking about a third study that Emily Douglas and I have also been involved in, but I'll focus on these two today. The first one is a survey study of 302 men who reported that they had been physically assaulted by a female partner sometime within the previous year. And the second study is a survey study of 611 men who had said that they had been assaulted by a female partner sometime in the course of their adult experience. Both of these were online convenience samples. We recruited them from several online sources such as domestic violence, listservs, listservs and online sources that focused on the health and mental health of men. They focus on divorced men's issues or fathering issues. So it is a convenience sample. So we don't know the extent to which we can generalize what we found here to all male victims. But this is similar to what you see in the female victim literature as well, where they tend to focus on convenience samples of female victims that you would find at shelters or so forth. And so similar generalizability problems. Just to give you an idea of who was in these samples, the first column is the first study of 302 men. The second column is the second study of 611 men. These men were on average in their early to mid 40s, and their partners were on average about 2 years younger. The majority of the men were white men. In the second study, we tried to increase the diversity of our sample, and we did achieve increased diversity of still majority white men. Their female partners were a little bit more diverse than the men. And on average, given their income and educational level, they tended to be about middle class. As far as their relationships are concerned, you can see here based on their mean relationship length and whether they were married or divorced, these were typically long-term, more established serious relationships lasting over 8 years, with the majority married to their partner, to their abusive partner at some point in time. In the first study, we see that more than half of the men were still with their partners. In the second study, it was less than that, about a quarter, and that's because we did look at lifetime experiences. In the first study, if the relationship had ended, it had ended 6 months ago on average. In the second study, it was almost 4 years ago. And the majority of men, at least 2/3 in both studies, had children with their abusive female partners. And I'd like to talk about first the experiences of aggression that the men had in these relationships. So for all of these slides, the blue bar is the first study where the men were victimized sometime in the previous year. The orange bar are men in the second study where they had been victimized at some point in their lifetime. And so you can see 100% of the men reported some kind of physical violence. And that's because we required that in order to be in our study. We did divide the violence out into different types of violence. So minor violence would be violence that's unlikely to cause an injury, such as grabbing, pushing, or shoving. Almost all of the men reported those types of violence as well. We looked at severe violence, which is violence considered to have a higher likelihood of causing an injury, such as punching, kicking, slamming against a wall, throwing something at your partner that could hurt. And you can see 85 to over 90% of the men reported that kind of violence as well. And very severe violence is violence that could be life-threatening. So things such as choking your partner, using a knife or gun on your partner, or beating up your partner. And over 50% of the men in our sample reported that as well. And here, for the purpose of kind of providing a voice to these men's experiences, I tried to pick out one quote to exemplify what I'm talking about. It's hard to pick out only one, but just to give you an idea of what these men were experiencing. So this man says, she thought it was funny to punch me in the kidneys. She thought that because I was so much bigger than her, that she couldn't hurt me, despite me repeatedly telling her otherwise. Now, one of the critiques of the literature on male victims of partner violence is, some acknowledge, okay, women can be violent, but it doesn't really hurt them. So one of the things we did was assess injuries. And we can see here that over 70% of the men, 78.5% or 72.8% reported that they had been injured as a result of their partner's behavior. And again, we divided this into minor and severe. So for minor violence, these were things like scrapes, cuts, and bruises. And a similar percentage reported that they experienced some type of minor injury. Severe injury would be things that would need medical attention, such as a broken bone or passing out from being hit on the head. And you can see over 35% of men in both samples reported that type of injury. And here's one man's experiences. Well, I have scars from my head down. I have 30 burn marks. I had a gun pointed at my head. I was pushed down a flight of stairs, was beaten up. And so a second argument that we typically see that argues against male victims' experiences is that, well, it's not just physical violence. Domestic violence, as Colleen had mentioned, is also psychological aggression and controlling behaviors. And men just don't experience this as much as women. There's one researcher in our field that calls this terroristic violence, and he defines this as frequent and severe physical partner violence accompanied by severe psychological aggression that takes place within a context of power and control. And this particular researcher argues that this is something that only men do to only women, or you rarely see it in any other context. But the data does not support that particular interpretation or that particular conclusion about the existence of terroristic violence. So there's lots of data sources I can pull from, but I think the most illustrative is the Canadian General Social Survey, which found that over 1/3 of the victims of terroristic violence victims in Canada during that time period were men. And this is a general population-based survey of Canada. And that 40% of male partner violence victims are terroristic violence victims, according to the criteria set forth by the researcher who coined this term. We looked at that as well in our second study, and we found that over 70% of the men in our second study could be classified as victims of terroristic violence based on the established criteria. And these are the percentages we saw for severe psychological aggression and controlling behaviors. You can see well over 90% of the men, large majority, are reporting both severe psychological aggression and controlling behaviors. And so severe psychological aggression were behaviors such as calling your partner fat, ugly, or a lousy lover, threatening your partner with physical harm, destroying something your partner cares about. Controlling behaviors were things like monitoring your partner's time and whereabouts, not allowing them to see family and friends, monitoring their computer activity and phone activity. Here's one man's example. She controls who we see, who I talk to, what I do with my time, and all our money. I have to hand her my checks. So a final critique that we see on male victims and that their experiences are not that severe is that we have research that shows that as many as 30 to 50% of women who are physically assaulted are also sexually assaulted. And surely men don't have those experiences when they're in abusive relationships with women. So we decided to ask that in our second study, and we asked about a variety of potentially sexually abusive experiences. And almost half of the men reported some type of sexual abuse in their relationship. Just over 43% said that their partner insisted on sex when they did not want to engage in sex. We do see that 28% reported that their partner threatened or physically forced them to have sex when they did not want to have sex. And here's one man's experience. Many things she tried to get me to do, but I was not into: urination on a person, female to male anal sex, bondage, etc. And so we do see that men's experiences of domestic violence can be very severe, that we see very severe physical aggression that can result in very severe injuries. We see this within a pattern of severe psychological aggression and control. And we do see that a minority of men are also reporting sexual assault experiences. One of the things we also see with sexual assault experiences is that within the context of these relationships, those who experience sexual assault are also in more dangerous relationships with higher levels of physical aggression, more life-threatening behaviors, and that is very consistent with what you see in the literature on female victims. One thing we also were particularly interested in is the mental health and physical health of the victims in our samples. And so just to orient you on this slide, the blue bar again is our men in study 1. The orange bar is the men in study 2. The brown bar is a population-based sample. We collected this in conjunction with study 2. And it's a population-based sample representative of the US population of men who are in relationships with women. And we gave them the same questionnaires and wanted to compare them with the men in our victim sample. We gave the men measures of PTSD and depression, and we looked at the percent of the men in each of these samples that reached what are called the clinical cutoffs. And so these are not diagnostic instruments that we gave the men, but these are instruments that have been developed that have cutoff scores that, should they be given a clinical assessment, they would likely be diagnosed with either PTSD or depression. They still need to have that clinical assessment, but this just gives us a likelihood, a good indication of their mental health. And so we can see for PTSD in the first study, almost 58% of the men reached the clinical cutoff for PTSD. 43% of the men in the second study did. And remember, in the second study, on average, these men were out of the relationships for 4 years if they were out of the relationships. And so that's why we see lower numbers. But I still think it's pretty significant that 43% were reaching this clinical cutoff for PTSD, even though they were out of these relationships on average 4 years ago. Only 2% of the men in the population-based sample reached a cutoff for PTSD. The differences were statistically significant for any of you who know your statistics. Even after controlling for other things, that could influence PTSD outcomes. In the second study, we also gave the men a measure of depression. 73% of the men reached the clinical cutoff for depression in comparison to 19% of the men in the population-based sample. Again, a statistically significant difference. So we see worse mental health for male victims of partner violence in compared to population-based samples of men. We also see worse physical health. And so we asked the men in the second study if they had ever been diagnosed with a range of physical health conditions. And what I have here are the ones where there were significant differences between the victims and the population-based samples. And you can see from the bottom axis here that the majority of these health outcomes were for cardiovascular types of issues. And I can't see the bottom of my screen here, so I actually can't read the x-axis, but it's things like angina and heart attacks and high blood pressure and high cholesterol and strokes. Men in the population-based sample were significantly less likely to have experienced these health outcomes in comparison to the male victims. And this is after controlling for other things that can influence those health outcomes. Male victims were also significantly more likely to be diagnosed with an STD and significantly more likely to be using disability equipment. And this man's one experience kind of gives light to what they're going through. The last 8 months we were together, I was having severe heart attack symptoms. Some mornings I would wake up and half my body would be numb. I often went to sleep hoping I wouldn't wake up, but I couldn't leave her because I was afraid for my children. During our relationship, I fell into a state of deep depression and experienced suicidal ideation. So this man here kind of sums up all of those poor health outcomes that I was sharing with you on the previous 2 slides. So we are seeing some severe outcomes from these men's experiences. Now, one of the things I'd like to bring to light in the context of today's topic is something called legal administrative abuse. And this is a type of abuse. The term was coined by some researchers in Australia, and they talked about it in terms of manipulating legal administrative resources to the detriment of their partners. And so this is something that we've seen men complain about a lot, male victims of partner violence complaining about a lot in our studies. And so we decided to assess it. This is certainly not unique to men as victims. We do see women as victims of legal administrative abuse as well, but it does seem to be more common among men as victims. And it is something that they do, like I said, complain about quite a bit. So in the first study, we asked men if they were ever falsely accused of hitting or beating up their partner or sexually abusing their partner. And you can see over 2/3 of them said they were. We also saw a substantial minority reporting that their partner filed restraining orders against him under false pretenses, that he was accused of physically abusing the children under false pretenses, and just over 10% reported that their partner falsely accused him of sexually abusing the children. And so in our second study, we decided to begin the development of a measure of legal and administrative abuse. And to orient you around this slide, there were 6 different types of legal administrative abuse that we measured. That she made false accusations to authorities that he physically or sexually abused her, that she made false accusations to authority that he physically or sexually abused the children, that she left and took the children away, left and took all the money and possessions, that she ruined his reputation at work, or that she ruined his reputation in the community. Now, the blue bar is men who reported that their partner threatened to do that at some point in time. So not necessarily that she did do it, but that she used it as a threat to control his behaviors in some way. The orange bar are men who reported that she actually engaged in that behavior. And so you can see over 90% of the men reported that she threatened at least one of those behaviors. And almost 79% of the men reported that she actually did carry out one of those behaviors. And the most common of those is false accusations to authorities that he physically or sexually abused her. You also see the next most common is ruining his reputation in the community, followed by leaving and taking all the money and possessions, followed by ruining his reputation at work. The next most common is leaving and taking the children away. And finally, a substantial minority did report this, but it is the least common, which is making false accusations to authorities that he physically or sexually abused the children. This man talks about his experiences of legal administrative abuse. I went to sleep. She said she was calling the police. I said, fine, she did. They arrested me with no proof or evidence of me doing anything. They dropped charges, but not before a 6-month restraining order on me, which destroyed my family and business, all based on her false allegations. So when thinking about these false allegations, one of the things that we're finding is that they seem to be successful because we assume that men are the perpetrators of abuse. Like I showed on one of the first slides in the presentation, that we do assume that men are the perpetrators and women are the victims. So when a woman accuses her estranged husband of abuse, often the accusations are assumed to be true. But if the reverse were to happen, it's not necessarily assumed to be true. And so I think one of our first steps is to really educate judges and other court officials on the full picture of domestic violence. My experience of meeting with judges and so forth is that this is not something that they're very much aware of. And so if they are aware of the full picture of domestic violence, that men can be victims too, that women can perpetrate these acts, that false allegations happen, then maybe we would have a better outcome for families that are experiencing these problems. Overall, though, I think my recommendations are that any accusation of domestic violence, whether true or not, should lead court officials to thoroughly and thoughtfully investigate the parents. So if the accusation is found to be true, then thought has to be given to whether regular contact with both parents is in the best interest of the children. Because sometimes domestic violence is actually a one-time incident. Sometimes it's just part of the divorcing process. And although it's wrong, it's not something that's continuing and it's not something that's going to put children in danger. If the accusation is unfounded, then attention has to be given to whether the accusation was false or whether there was just evidence, there was just not evidence to support the accusation. If it's the former, that it was a false accusation, then that points to a parent who's going to need some attention and some education on how false accusations can negatively impact their children and others involved. But in any of these situations, it suggests that continued monitoring the family is necessary to ensure that the best interests of the children are always maintained. And I'd like to end with a final question that I know our final speaker, Bill Fabricius, is going to provide some data on, or at least I think he is, which is, will mandating shared parenting increase false accusations of domestic violence? It's something I've struggled with. I'm supportive of shared parenting legislation, but they always have in there a stipulation that, of course, you know, there's exceptions for domestic violence situations. And so I do have a fear that if you mandate shared parenting with that stipulation, that perhaps it will increase the likelihood of false accusations. So I think legislation needs to be thought through that really carefully considers how can we prevent false accusations, how can we investigate them, how can we properly ensure that we are doing what's in the best interests of the children in light of these issues. And with that, I'd be happy to take any questions. And thank you all for your attention. Colleen, you're on mute.
Thank you, Dr. Hines. That was an excellent presentation. I could just be on here myself all day asking a ton of questions. I think one of the things that you brought to light was something that I often have struggled with myself, is that when an accusation is made, whoever it is against, the mother or the father, there can be weeks, sometimes months before that accused parent gets to see their children. I think that is the area that really has to be figured out, because it can also set the situation up or lay a foundation in some cases for parental alienation early on. So but thank you so much. There's a wealth of information in your presentation. I'm really appreciative. You did a great job. With that being said, at this point, I'd like to invite the legislators to share comments or ask questions pertinent to Professor Hines' presentation. If you could do so by raising your hand, and then we can unmute you to do that. Is there anyone who has a question for?
And the legislators can unmute themselves, by the way.
Oh, they can. Okay, thank you, John. Is there any of the legislators that like to?
And Senator Anwar, please.
Thank you.
Thank you so much for the presentation. You have shared the study on already identified individuals. It's worthy to look at the broader probability. It's almost like if you look at the risk of domestic abuse, the overwhelming majority of the victims are women. But you have shared the story in the narrative of men, including anecdotes. And I understand where you're coming from, and I understand the group's perspective, but it's almost is worthy to look at the probabilities, because if you take a selected group and then look at the depth of that, it almost creates a narrative. Just for fairness sake, it would be worth it to have a broader probability perspective as well.
Thank you for that comment. I do appreciate that. There are population-based studies that show that at least a significant minority of men are victims of domestic violence. So we do see that it is much more common than most people know. One of the reasons why we don't know as much about male victims or don't hear about their experiences as much is because they are less likely to seek help. And when they do seek help, they're less likely to seek help from your traditional domestic violence agency. And they're also less likely to receive help from those traditional domestic violence agencies. They're more likely to be turned away. And so they remain sort of hidden victims of domestic violence, but they are a lot more common than we think. And the population-based surveys show that they are at least 20% of the victims, if not as much as half of the victims.
Thank you. I see Representative.
Claritas
Yeah,
Dietrich.
Claritas, thank you. Do you have a question?
Yes, thank you so much. Good job, Claritas Dietrich. Thank you for having us today. My question to Denise, did you say that men, not typically, but will get turned away from the domestic violence shelters?
Yeah, I do have
agencies?
data. Yes. I'm sorry, did you have more to your question?
No, that was my question.
Oh, okay. Yes, so I didn't have time to present that data today, but we do have data that shows that more than 2/3 of men who've sought help from a domestic violence agency have found it unhelpful and are typically turned away or somehow accused of being the real abuser in the relationship or doing something to somehow cause the abuse. And so the reaction to men and women is typically not the same when they reach out to domestic violence agencies. So it is a problem. One of the things that I find hopeful is that since we've collected that data, my colleagues and I have been asked in many different situations and in the state of Connecticut too, to train domestic violence agencies on male victims. So I'm hoping the situation is getting better. We are actually poised to collect some more data to see if it has gotten better since the last time we assessed that.
Oh, good. That's encouraging to hear. And that was my next comment, that maybe there needs to be some updated training for our agencies in regards to men, so we can help, keep this problem from happening again and let the men get the help that they deserve, just as much as women. So thank you. Thank you for everything.
Thank you.
Thank you. I see Representative Jillian Gilchrist.
Thank you so much. And thank you, Denise, for your data and your information. Just wanted to respond on that previous comment. So I previously worked for the Connecticut Coalition Against Domestic Violence, and good news in our state is is if a man does present looking for emergency shelter, if there is a policy that men over the age of 18 can't be in the shelter for safety concerns, they will be housed in a hotel if they feel comfortable. And then the Safe Connect 24-hour, 7-day-a-week hotline is available for both male and female victims of domestic violence.
Thank you. And it was the State Coalition Against Domestic Violence that I did do a training for a few years back. Yeah.
Fantastic, thank you.
Thank you.
Thank you. Are there any other representatives or senators that we would like to speak with Dr. Hines? Dr. Hines, if not, we have Daniel Cowan waiting in the wings there.
Go ahead, Dan.
So in one of your slides, you mentioned that over 55% of domestic violence perpetrators threaten to take the children away. What percentage of the victims lose access to the children after those threats are made?
That's something we do not have the data on. So it's not a question I can answer.
All right. I had one other follow-up question to that. Has any research been done on the outcomes of these children that are involved in the cases of legal domestic violence?
I'm not aware of that. I'm wondering if maybe Bill Fabricius knows the answer to that question. He's speaking a little later. I do have some folks, I think, I'm thinking of Jennifer Harmon at the University of Colorado, or actually Colorado State University, who's done some work on that. She might have some data on that. Bill, if you're there, would you happen to know if there's some information to answer that question?
I haven't seen too much, but I will be talking about our findings regarding that later.
Okay, great. So stay tuned.
All right, if that's all the questions, thank you, Dr. Hines. Appreciate your presentation. It was excellent, obviously thought-provoking as well. Next, we'll be hearing from Dr. Alexandra Lysova, PhD, is an assistant professor in the School of Criminology at Simon Fraser University in British Columbia, Canada. She has studied intimate partner violence, including violence against women and children, for over 15 years in Russia and currently in Canada. Recently, she has focused on men's experience of intimate partner violence, including victimization, help-seeking behavior, and issues involving children. In her research, she draws on the results of the international focus groups among male victims in 4 English-speaking countries: Canadian General Social Survey on Victimization and Homicide Survey. Dr. Lysova's research has been supported by the prestigious foundations, including Trudeau, Fulbright, Carnegie, and Humboldt Foundations, and also the United States Library of Congress and Max Planck Institute. Her recent publications appear in the Journal of Interpersonal Violence, Criminal Justice and Behavior, Journal of Family Violence, Violence and Victims, European Journal of Criminology, Theoretical Criminology, and Handbook of European Homicide. Dr. Lysova, thank you so much for coming today. The floor is yours.
Thank you so much, Colleen. Thank you for this presentation. So first, let me please share my screen. Thank you very much, everybody. Let me see right now. I see all the faces, and I'll just, I'd like to see like this. Okay. Thank you again. This is a great pleasure and honor to be here today. So yes, thank you, Colleen. I've started my work on examining domestic violence in Russia. And while I was there in the far east of Russia in Vladivostok, I focused on violence against women. It is a big issue in Russia, and focused on violence against children in Russia. And once I moved to Canada, I continued with my research on intimate partner violence and started to look more at the complexities of intimate partner violence, and more recent studies showing that it is much more complex. So there are also men who are engaged in violent interaction, and not necessarily as perpetrators, but also as victims. And in my recent years in Canada, I'm involved in this work and doing research on female aggression and male victimization. So in this presentation today, my presentation called Stacked Against Me, Perceptions of Institutional Response to Incidents of Partner Abuse Involving Men and Their Children, I will continue actually the talk started by Dr. Hines. And I would like to make the same disclaimer, which is we have to acknowledge very serious consequences of abuse and violence for women in the relationship. Women are at greater risk of serious injuries and death and homicide. At the same time, we know that there is a large proportions of men who are victims in the relationship. And there was a very good question about the population studies that would show the how many men and women become victims of violence, particularly again in the representative national samples. I will be reporting on this in my presentation in relation to Canada. So my talk will be, again, is similar in a way that it will focus on men, simply because we still have very much limited information about men and particularly their children in this abusive relationship. But it will be different from Denise's Hines talk because it will continue on, first of all, in several directions. First of all, it will focus on the international perspective. So I will be reporting results of my work in Canada and also internationally. The study that I will be discussing today, presenting the results of it today, come from 4 English-speaking countries. So this is, again, this kind of international context to this issue. The second is it's a qualitative study. So we were looking for the ways to hear voices of men, how they perceive what happened to them and how they see and evaluate the help they receive from the institutional official help agencies. And third, in my presentation, I would like to focus more on the, again, relationship of the men with the children and the attempts to find help in family court in these 4 English-speaking countries and see how if they find it effective. So this is about, again, this is how my talk will be different a little bit from what Dr. Hines presented. So again, in terms of the literature on male victims partner abuse, Denise Hines presented this very comprehensive literature review in relation to the United States specifically. And I would like to focus more on the Canadian experience. And these are the results of the study on the population survey in Canada very recently. I published this study in 2019. It's based on the General Social Survey on victimization in Canada. This is the largest national survey on victimization conducted every 5 years. And the most recent cycle on victimization was conducted in 2014, so we can analyze that data. So I've looked actually at how many Canadian men and women report victimization in their relationship, and this is what we get. So when men and women were asked about being victims of, if they have experienced some of the forms that we see as physical and sexual violence, we found that 2.9% of men in Canada reported being victims of one of these forms of abuse, and 1.7% of women. And this difference is statistically significant. So these findings are also published by Statistics Canada in the Family Violence in Canada special edition. The only thing is that these numbers are published, but they're not explained in any way. I would say they kind of ignored. And I think it's really important to put it in light and try to explain these findings. Where in relation to the psychological and financial abuse, we see that 10.1% of men reported being experiencing one of the forms that measured psychological and financial abuse. And some of these forms include something that Denise Hines mentioned, because it's the same tool, it's the same conflict tactic skills that are used in Canada to measure violence. And again, the majority, the 10% of men in Canada reported that they've been victims of this abuse compared to 6.8% of women. And again, the difference is statistically significant. So again, it addresses the question that in some countries, the number of male victims may be even higher. The only important note here is that these findings relate to the men and women in ongoing, in current relationship. And maybe this is also important because at that time when the study was conducted in Canada, and again, this is a representative study based on the random sample of Canadians in 2014, those men and women were in relationship with those who where they experience violence. So it's very important to understand how we can help these couples. When we looked at the context of intimate partner violence and specifically the coercive control, so we looked at the men and women who were victims of physical or sexual violence, and if they experienced what is called coercive control. So what we found is that over a third of these men and women actually experienced what we called high controlling behaviors. And Denise Hines mentions study conducted in Canada in 2008. And this study is a very recent one and based on 2014 statistics, and it confirms these results. Again, over a third of, if we focus here on men and women as well, experience high controlling behaviors in these relationships. And what I found interesting that if we look at the severe physical or sexual violence in relationship, and among these men and women, 22% of men and 19% of women experienced what we called this intimate terrorism or terroristic violence. Again, that would estimate as 28,000 of Canadian men and 16,000 of Canadian women who are in particularly dangerous relationship at that moment in 2014, because this relationship are current. So again, that's important, points on not only to the large number of men and women who are in extremely dangerous relationship, but also to the number of men who become victims of this type of abuse. And many people are still not aware that men may become victims of abuse, particularly severe forms of abuse. And the next one is we looked at, and this again, it's based on the national representative study of intimate partner violence in Canada in 2014. When we looked at the consequences of intimate partner violence for men and women, what we found is that it's well documented in the literature is that majority of those who suffer from injuries are women. So women are at much higher risk of being injured. However, if we look at an estimate to the population in Canada, we see that around 12% of men who were injured in the result of violence, it translates to about 30,000 men compared to 39,000 of women. And then again, in terms of the emotional impact, men report much less fear as a result of intimate partner violence. However, when we looked at the items that measure post-traumatic stress disorder, we do not see significant differences in the responses between men and women, which suggests that men suffer from violence and they experience quite severe forms of what can be seen as post-traumatic stress disorder. And it also gives us an idea that there may be some other consequences for men that we do not simply even measure on the large population studies, something more specific, gender specific for men. Like, for example, fear is not what they experience, but maybe they experience something else. So we need to continue to do some qualitative studies to find out more about this specific, potential specific consequences of violence for men. So this was the results of the population study. And then if when we look at the literature that would examine children in the relationships when men are the primary victims, it's very limited. Most of the literature out there focuses on women along with children in the relationship. So there is a core victimization or co-occurring of violence for both women and children. And the literature when the men are primary victims and how the children are affected in this relationship is very limited. That explains my focus in this presentation today on men and their children in the relationship. So in order to get this data, several researchers from 4 English-speaking countries, along with Dr. Hines and Dr. Douglas from the United States, we had 2 more collaborators from Australia and from the United Kingdom. So 4 countries together. We collected data using online technology. It was back in 2012, 2013, and now it's much more popular to do this research due to the pandemic. At that time, it was quite an innovative survey study. We did 12 focus groups, each lasting 1.5 hours. So in each group, we had 3 to 4 men, and that was a very detailed talk, detailed discussion on the experiences of abuse by men. And we had total sample 41 men. Yes, it is a rather small sample. However, this is what the many qualitative studies have, since they focus more on the narratives and identifying the themes. That is important. It's hard to have a larger sample and have some meaningful results. This sample is not representative of any large population, but it's very important really to have an ability to hear the voices of men and how they explain what happened to them, and to hear their attempts, how they try to help children in the relationship. So in this study, we had 5 major questions, and none of the questions actually asked men about their relationship with children in this abusive relationship. And despite that, 83% of men, 34 of them, talked about children in this abusive relationship. And this is what I analyzed for this presentation today. We used the thematic analysis and looked at the prevalent themes in their narratives. So when I present the results of my work, I here focus on 3 major areas, something that we identified. First of all, it's children's experiences of abuse as reported by male victims in our sample. Then I will describe what we found in relation to men's responses to children's abuse, how they try to find help, and how they see if this help was effective. And also what we found is that the men talked differently about the experiences with trying to find help to children's abuse. And we found more active position versus more what is being actually found in literature on violence against women is kind of more learned helplessness, when men feel very hopeless and they don't want to continue with any attempts to help. So so first, children as victims of abuse. It's interesting that 34 men who, despite us not asking the direct question about children being involved in this abusive relationship, talked about this. All of them reported that children were actually victims of abuse as well. And when they talked about this, they actually highlighted the victimization of children first, even over their own victimization. For example, one man said, "It wasn't just with me, all 4 of the children were victims as well." And another man said, "The real victims, the real absolute victims for me are my children." So again, we see that how much they care about children, how much they focus on what happens to children in this relationship. All these men who talked about children described different forms of abuse against children in this abusive relationship. Some described neglect, especially in relation to young children, when mothers wouldn't feed the child, wouldn't give a medication. So the fathers had to do that, even though they were not quite aware of how to do that. Many of the men reported that children witnessed the abuse of them. So this is what most of them said, that they were humiliated and embarrassed in front of their children. Children were also physically and psychologically abused along with fathers. And in several cases, men reported that children were even kidnapped by their partners. So for example, one man said that he came to pick up his child from daycare, but his female partner already picked him up, and he even didn't know where to look for his child. And again, these cases, I believe around 6 men reported that happened in these relationships. Also, many men reported that children were used to manipulate them. So the children were told negative stories about fathers. She denied all contact with the children and used them as a weapon against me. Again, it is interesting that we've heard this word, man kept repeating, a weapon against me. So children were actively used in divorce to a certain degree, how men saw it to manipulate the man. So men's responses to children's abuse was mostly they wanted to help. So this is what we've seen as men as a protector. So they contacted the police, the courts, or the cases came to the attention of the officials. And here I would like to report on perceptions of these institutional responses and help. So most of this contact with the official agencies were unhelpful. And these are the 3 themes that we have identified in the narratives of the abused man. It was this non-responsive on an indifferent structure. The second was stacked against me, or a gender bias in the system against men, and legal abuse and parental alienation. So I'd like to provide some narratives that will illustrate what it means under non-responsive and indifferent structure. So Richard from the United States said this: I have made all my child support payments, but have been denied visitation. The state of Alaska would come after me with legal action if I didn't make my payments, but the state of Alaska will do nothing to enforce the court order visitation. Another participant from the UK said this: every one of those trained professionals was aiding and abetting a perpetrator who continued to abuse and neglect my children for 2 years. I was away from the children, and that constitutes some of the worst abuse that I experienced, never mind the time I was in the relationship and the abuses I then suffered from all of the agencies. This is interesting. We hear this, that it's almost like a double abuse that men experience, one from the abuser and second from the agencies. Another participant from the UK said it was only when things became so bad for the children that the social services took them into care from the abusive mother. Again, it looks like the situation should become too bad for children when somebody will pay attention. Again, this is some of the sentiments we hear from men. In terms of the gendered enterprise or stacked against me, we hear this. Nicholas from Canada said this: when we went to family court, in spite of her history of abuse and documented records from the Children's Aid Society of beatings of the children, the court still awarded our youngest daughter to the mother. And as a result, my daughter has, to this day, 20 years of abuse. In another case, the man from the UK said the system did nothing. It acknowledged that she admitted to being an abuser and left her with the house and the children, and me with nothing. In another case, another participant from the UK, I literally wrote 2 lines to the court: please help me see my children. And guess what? There was none. Everything was stacked against me. So here we see that, and there are many more examples when men express this concern that the women are treated differently and they get more, even if the abuse came to the attention of the court. So in terms of the legal abuse and parental alienation, Richard from the United States said this: it's far too easy for women to sue the courts as another form of abuse against their men. She picked up fairly quickly the option that if she could provoke me to anger, that she could then use that as an excuse why I should be kept from my son. This is the idea that women are aware that the system was designed to help better women, and they may use the system to threaten men with the legal action. Another participant from Australia said she has just denied all contact with the children on a whim, just using them as weapons. Again, something that we heard quite often from men. And then Samuel from the United States, her principal weapon was trying to put the kids in the middle of the divorce. Again, highlighting the incidence of parental alienation when children would be alienated from the father and used to benefit the abuser, in this case, the mother. So, however, two men, and two of them actually come from Canada, believed that the system worked for them, but the way how they explained it, it was mostly luck. So Richard from Canada said, we just went for a custody battle, and part of the custody battle, we both were investigated in the Office of Children's Work for Ontario. They are a nightmare for dudes, but I lucked out. Again, he was successful, but seen it's more as a luck rather than a kind of a more expected result in his case. And John from Canada said, I'm in the 2% of men who ended up with custody and had his sort of experience. This number may not be right, but this is the impression men have about how the system works. And then I've mentioned that what we also noticed was the tone of the discussion, the way how men talked about the being involved in the family court proceedings. And the one thing was this active position, and one was more a learned helplessness. They feel tired, exhausted. They didn't believe in the resolution, and they would just give up. So as an example of this active position was Daniel from the UK. The only battle, if you like, the only thing I had to do then was fight through the courts for my son, which I've been doing for 6 years. 6 years in the court fighting for the custody of his child. And then Brad in the United States, we separated with false claims of domestic violence, and she took my daughter. She wouldn't tell me where she was and how I could contact her. And that's pretty much been the theme ever since she left. And that was about 3.5 years ago. So we hear this idea that the man is tired and cannot do much to help him see his daughter. Another one from the United States said, arrest warrant was going to put out for me because a lack of payment, because they didn't have things in position yet. So that went bad. And ever since then, I've been the bad parent, and she's been the loving one who is taking care of your son. And so after a while, I got tired of talking. Yeah, so again, the highlighting the situation of the feeling of how men would experience this situation as learned helplessness, being tired of doing anything. In terms of the thoughts on shared parenting, given all these responses from men we received, it appears that the most important aspect is, of course, to focus on what is in the best interest of children in the relationship. And it appears that screening is really very, very important. Thorough screening for intimate partner violence and child abuse, using focusing particularly on 3P PPP screening, what it's called, with the focus on the potency of abuse, which means the severity of abuse and danger for victims involved in the abuse. And then it's a pattern of abuse, which is looking at the coercive control in the relationship, which is really important pattern that is dangerous one. And the third is a principal perpetrator. So it's important to identify who these three Ps, what these 3 Ps are, and to apply a differentiated approach to parenting plans. And shared parenting may be an option and maybe not, depending on the severity of the case, given that the intimate partner violence is not a uniform phenomenon, and the couples experience it very, very differently. And if we look at the Michael Johnson's typology of abuse, when we see couples having more situational violence without pattern of coercive control, and some couples experience more coercive control and very dangerous forms of violence, which is more like an intimate terrorism or terroristic violence. Denise Hines talked about it. So again, in these cases, the decisions should be very, very different. So, but many fathers feel that they're being dealt in litigation harshly and unfairly. So even because they are victims, it may be very difficult for them to effectively fight for this case in court. And some, due to the frustration and experiences of abuse, their victimization, the fathers, it may actually limit the father's chances to win the case of shared parenting in court. And according to a British Columbia lawyer, I found this very interesting. He said judges still think of men as inherently more brutal and dishonest than women, and it's always an uphill struggle for fathers in court. So they have to do more in order to get what women can get. And in terms of implications, yes, it is important to continue focus on fathers' experiences of intimate partner violence. We still do not know much. This literature has been just appearing, and Dr. Hines explained this important and very innovative study that she and Dr. Douglas started in the United States. This is indeed a very important line of study, and it's been picked up in many countries right now, particularly industrialized countries, with the study of men's experiences of abuse. And again, we need to also focus on fathers' experiences of abuse and how their children experience it. And this is the PPP screening that I talked about above. So to look at the severity of abuse, to look at the pattern of coercive control and who is the primary perpetrator, and then decide on the parenting, solutions. Addressing parental alienation, it's an important form of violence in the relationship. Address institutional gendered enterprise, something that men experience as a bias in the system against men. To develop more gender inclusive and male-friendly legal regulation of child custody and access. Again, the entire situation with men, when we see that the men actually report victimization on population studies, but we don't see them a lot among those who look for help, that's a very important. That creates sometimes the idea that men are not real victims, but the point is that the men may be very much feel very much intimidated by the system and feel that they're not treated equal in the system with women. And again, that should be addressed. And then shared parenting and alternatives to cases IPV should be explored. And again, screening, I guess, is a very important step in this direction. So thank you. Thank you for your attention. And please let me know if you have questions.
Thank you, Dr. Lysova. That was excellent. And again, another situation where we can sit and have conversation for a very long time. There's so many issues inherent in your conversation. I think one of the things that I took away, and I will turn over the time in a minute, is putting the importance of giving a framework and a foundational piece to family court. And that is not necessarily with attorneys, but because it's such an emotionally charged situation that people find themselves in, that putting the professionals around them that are appropriate to handle that situation, which is not necessarily attorneys all the time. And so I just, I was really struck by, when both parties enter the court, everyone's intimidated from the get-go, but no one wants to feel like anybody has an upper hand for sure. So thank you for that. I'd like to open it up to our legislators. If they have any questions or comments for Dr. Lysova based on her presentation, we'd like to have you raise your hand, and you can unmute yourself and feel free to go ahead and ask a question.
I'm sorry, I'm on a cell phone and I can't quite find my my raise hand feature, but
okay, that's okay.
Representative Robin Comey, and I've been in the car, so my apologies for just tuning in person. Just arrived at the destination. My question is, and I'm not sure that you've covered this at all, is what is the interaction when situations occur and the police are called in? What is the interactions when the from law enforcement, and do you have any research or knowledge about that?
Mm-hmm. In our study, we looked at the interaction of these male victims with the police. And again, we found that men find this interaction not positive and not helpful. I think in our sample, we found only in one case when the man was treated with respect and understanding. And only because, as it turned out later, the police officer said that I just know about this experience, I've had it myself. So, and if it was a personal experience the police officer had, then there was shown this sympathy to the victim, male victim. But in the rest of the cases, men said that they were not simply treated as victims. The women immediately were treated as victims more. They were provided with the list of sources they could go. And in several occasions, men were actually arrested when they called the police. So unfortunately, it looks like there should be some work with the police officers with about more recognition of the male who may suffer abuse in this relationship.
Thank you, Representative Comey, and thank you, Dr. Lysova. Is there anybody else for legislators who representatives, anybody who would like to ask a question for Dr. Lysova before we open it up to our other audience, the regular audience? Okay, if not, then go ahead.
Yeah, Colleen, I think we need to make sure Dr. Fabricius has a chance to do his presentation.
No, I'm just looking for questions for Dr. Lysova, John.
Okay.
Is there anybody else?
No, if you're rushed for time, I was just going to ask a follow-up question, but thank you very much.
No, go ahead, Representative Comey. We're fine.
So I would think that there would be some, I mean, I have personal knowledge of a person that I know that has had to go to court as a woman for having, attempted to hurt her husband. And it was during the pandemic. And I'm just wondering if there's any data on that specific, what kinds of data there is on with the police departments and with the court system with that.
I know there are more studies right now appearing on the effect of the pandemic, and we know it appears there were more cases right now during the pandemic due to various factors, because people are stuck home together, and there is more stress, financial stress, emotional stress. Children are home as well, so it appears that creates more difficulties and more stress for everybody, and more cases of family violence. In terms of interactions, I'm not sure, I haven't seen the most recent studies on that. The only thing I'd like to mention is that there is a large literature out there on women's experiences with the family court, and many women are not satisfied with the system as well. I've just reviewed some studies yesterday, and the point is that women cite so many problems very similar to what we found with men, that the abuse is not treated seriously, that there is this victimization in the court setting, that they have to face the abuser, and it's hard for children and for them. So again, it's not necessarily men's issue. It looks like it's both men and women's issue, those who are victims of abuse, what they have in the family court setting.
Thank you, Dr. Lysova. Thank you, Representative Comey. Great question. I'd like to introduce now our final panelist, Dr. William Fabricius. Professor William Fabricius, PhD, is Associate Professor of Psychology and Affiliate Faculty in the Interdisciplinary Law and Psychology Graduate Program at Arizona State University. He received his PhD in Developmental Psychology from the University of Michigan. He's authored over 70 peer-reviewed empirical research articles in the areas of child development and law, and has been principal investigator on research grants from the National Institutes of Health, including a 10-year longitudinal study of the role of fathers in adolescent and young adult mental and physical health. Dr. Fabricius was instrumental in the passage of equal parenting time legislation in Arizona in 2013. Thank you for coming, Dr. Fabricius. The floor is yours.
Thank you, Colleen, for that introduction, and thank you for the invitation to be here today. Very, very honored to do this. So I will share my screen. I believe this is it. Is that okay? All right, so I will talk to you today about shared parenting and parent violence, listening to the children of divorce. I want to start with a couple of introductory remarks that I'm excited to see to read about in Connecticut's new family court process that urges a triage and pathways approach with goals to achieve timely and effective resolution of the divorce cases, to help families on cooperative resolutions. I'm impressed, and I'm excited to see those reforms. I'm also excited to hear that about Connecticut's domestic violence reform efforts in recognizing coercive controlling behaviors as a form of domestic violence. We tried to do this in Arizona when we revised our custody statutes in 2013. We didn't really succeed on the coercive controlling language because we just didn't, it wasn't emphasized enough that a history of coercive controlling behaviors really does validate the allegations of them and can be used to reassure the courts that that frivolous allegations of coercive control are hard to make because real coercive control has a verifiable history in the relationship. Of course, we were successful in instituting essentially a rebuttable presumption of equal parenting time in 2013. And I'll just mention in regard to one of Denise's questions about would that result in an increase in allegations, false allegations of violence, domestic violence. And we really haven't seen that. We've evaluated the law. We did see a slight increase, which I take to mean that could be encouraging because sometimes there's the opposite concern about an equal parenting time presumption that it might suppress genuine allegations of domestic violence or abuse, but we certainly didn't see that. The family law community in Arizona is very, very pleased with how the law has been working since 2013. I would invite any legislators from Connecticut to call your peers in Arizona or call family law professionals, the judges in Maricopa County, the conciliation court directors. I can put you in contact with lots of people to talk to hear about how it's working, how judges individualize equal parenting time, and how parents are educated about it. And family law community in Arizona is very proud of it. There have been no attempts to modify or change the law since then. So I think it's a model for how it can work. So, as I mentioned, a history of coercive control it's really the best predictor of false allegations of domestic violence, continuing frivolous lawsuits, lack of cooperative parenting, and predictor of attempts to alienate children from the other parent. So what's the remedy? Coercive control really is a personality trait, and courts cannot change personality, but what courts can do is change behavior, and they can do that by using what we understand about reinforcement smartly. And I just noted a few suggestions in preparation for this. I mean, one would be don't reinforce coercive controlling behaviors by allowing those parents to win primary custody. Secondly, warn them from the beginning that coercive control will result in loss of parenting time. I think a third important thing is and you're probably doing this in Connecticut, but planning to do it, but train your county custody evaluators to look for and recognize a history of coercive controlling behaviors and present that good evidence to the court. Custody evaluators are in a perfect position to unearth that a history of coercive controlling. And finally, I think adopting a rebuttable presumption of equal parenting time to deter coercive control fights over custody, and to emphasize to each parent from the beginning of the divorce proceeding that it's their responsibility to provide a home for their children. Those would be some things to consider. But my presentation today is on the psychology research evidence that, by now I've become convinced, as much as the scientists can be convinced by data and evidence, but I'm convinced now that equal parenting time is best, even in high conflict families, and now in families with a history of domestic violence. In my research, we haven't been able to study and focus particularly on coercive control yet, but I believe the principles and processes apply in that case as well. So I'm concerned about how does the child witnessing domestic violence, how does that work to harm children? And what are the implications then for equal parenting time? in general, when divorce does harm children, it does not always, but when it does so generally by causing emotional insecurity in children. So that's what we're going to start with. Emotional insecurity. First of all, why is that important to focus on? Well, because it affects children's mental and physical health in the long term. So emotional insecurity causes psychological distress, psychological stress reactions involving the autonomic nervous system, results in chronic release of stress hormones throughout the body that affect many systems in the body, including the immune system. And chronic exposure to stress leads to substantial physical health problems in later life. We know that stress kills. Emotional insecurity also leads to substantial mental health problems in later life, such as defensive hostility and destructive anger. And experiencing an emotional insecurity in childhood also contributes later to self-medication by substance abuse. So there's an immense literature here on the long-term effects of chronic exposure to stress. And for children, the most important stressor is emotional insecurity regarding their family. So let's look here there are three main sources of emotional insecurity for children. One is insecurity about me and mom, insecurity about my relationship with mom. And the fear here, we found a good way to characterize this fear is worries about whether I matter to mom, right? Whether she'll be there for me, whether I can count on her. Same thing for dad, insecurity about me and dad, worries about do I matter to dad. The third source of insecurity is what we can call insecurity about my family cohesion. And this is children looking at the relationship between mom and dad and how strong that is and whether that relationship will be able to work for me. That's what children are concerned about. In this case, insecurity about family cohesion is felt by the child as fear of being abandoned by my family. What we know about what we're going to do today is just focus on this type of insecurity. Keep in mind that that's not the only source of insecurity for children. The other two sources about their relationship with each parent are equally important, have similar implications for equal parenting time after divorce. But I'm just going to focus on this insecurity about family cohesion in this talk. What we know about that is that parent conflict, exposure to parent conflict causes this type of emotional insecurity in children. It's a worry that if my parents are fighting, they're going to forget about me, I will be ignored, and I might be abandoned. So it's important to really understand what that means, and that's separate from whether I'm secure with mom, if I know she loves me and I matter to her, whether I'm secure with dad. This is a third source about whether my parents are going to be able to function as a unit and continue to care for me. So what we're going to do today is we're going to ask about whether witnessing parent violence also causes this same insecurity. And then what does witnessing parent violence and domestic violence, what does that mean? What are the implications for parenting time? So let's just try to, first of all, really understand how this emotional insecurity about family cohesion, how does that feel to children? For children, it arouses these kinds of distressful feelings. When my parents argued, I got scared. I worried about what would happen to me. I worried that one of them would get hurt. I worried they might get divorced. Right? So this is how children experience it. This is how we measure it in children. The thing about emotional insecurity is that it persists throughout childhood and into young adulthood and beyond. So childhood experiences that are strong enough to arouse emotional insecurity, change the individual stress response system, and that's what sets the individual up for future health problems because of the changes in the central nervous system, essentially, that have been caused by early childhood exposure to stress. So we can look at this in young adults. In young adults, we see the same kind of thing, emotional insecurity about family cohesion as a result of exposure to parent conflict earlier. It lingers in young adults in similar distressful feelings, and we measure this lingering insecurity about parent conflict with items, surveys, questionnaires that ask the following questions. Rate, I had a harder childhood than most. A lot of my parents' problems were because of me. I worry about events where both parents will be there, and I feel doomed to repeat my parents' problems. So we can see that these kinds of lingering distressful feelings are related to health problems, and they can be traced back to experience of parent conflict. So what we have done in the research I'll talk about today is to look at a group of high parent conflict families. These are families where the young adult children reported that they had experienced highly severe parent conflict during and around the time of the parent's divorce. So what we're looking at now is these children, when they've grown up and they're adults, what about their lingering emotional insecurity about family cohesion stemming from parent conflict? How does that relate to the amount of parenting time that they had with their fathers after the divorce? Right? So these are high conflict families, high conflict divorced families, looking years later now when the child has grown into a young adult, and we're measuring lingering emotional insecurity stemming from the parent conflict that is going to put these young adults at health risks, stress-related health risks. And the question is more parenting time with father, towards more equal parenting time, is that harmful to children from these high parent conflict families? What most people assume now and from previous literature is that more equal parenting time could expose the child to more of the conflict, which could cause more of the insecurity, which could lead to the health problem. But the problem with the older literature is that few parents had equal parenting time in the past, so we didn't know what the effects were for high conflict families that had equal parenting time. So what we're going to show you here are the findings. So I want to focus you first on the vertical axis here. And as you get higher on this axis, this is reports of more lingering emotional insecurity that the adult children are reporting currently their emotional insecurity about their childhood experiences. So high is bad, low is good, 0 is sort of the average. And what we're looking at here are 6 categories of parenting time per month. So 0 days, 10% time, 20, 30, 40, and 50% parenting time, equal time with dad, all right, per month. Okay. All right, so what do we see? Let's start at the left end. Children who grew up essentially not seeing their fathers in high conflict families are now, as young adults, reporting very little stress about the conflict that they witnessed. So think about that, right? If the child's not seeing the father anyway, but the child's hearing about and experiencing that there was high conflict in the family, that conflict's not going to threaten the child's family cohesion because the child was not really seeing dad much at all after the divorce. So you could say that the conflict means the child's not worried about losing family cohesion because there isn't. that child is just depending on mom. However, when we move up to 10, 20, and about 30% parenting time, you can see now in the young adults the leftover or the still persistent emotional insecurity stemming from the parent conflict when the child had, around 10, 20, 30% parenting time. When we think about that, that's a moderate level of stress these young adults are feeling. Think about why is it moderate? Well, because I'm not really seeing dad that much. My primary home is with mom. If they're fighting and they can't work together, it's not going to affect me too much because mom is my primary home. But when you get, very interesting, you get to about 35 to 45% parenting time, or around 40 on the average, you see a real peak in this long-term stress about the conflict. Why? We think that means that for those children who are seeing dad about 30, 35% of the time, they feel like they have a lot to lose if the conflict destroys their family cohesion. 35% parenting time is enough for the child to depend on dad's home, but also enough to make the child worry that if dad leaves or if mom moves away because of the conflict, I am really going to be left with a loss. At 50% parenting time, the stress, the long-term stress over the parent conflict in childhood, if that child had equal parenting time in a high conflict family, we see a large decrease in the amount of emotional insecurity about that parent conflict. Right? Why? Well, I think what that means is that two equal homes, if the child has two equal homes after the divorce, even if the parents are in high conflict, the child has a physical sort of reassurance that neither parent is leaving. I have an equal home at both places, and that seems to insulate them to the insecurity that results from exposure to parent conflict. We're not the only ones who have found this. There are other researchers who have found it, and I'm pretty convinced that this is a real finding. What we want to do in this presentation now is look at children's exposure to domestic violence. Right? This is just their exposure to high parent conflict. So let's see if we get this same pattern of lingering stress about conflict and violence differing as a function of the amount of parenting time these young adults had when they were children, right? So in this case, what we're doing, how do we measure domestic violence? In this case, we're asking the young adults. So I think this can be useful because it's not a convenient sample in the sense of parents deciding to respond to a survey about domestic violence, but this is now asking college students from divorced families what they experienced about physical violence or physical abuse by each of their parents toward the other. So this is what we assessed. We asked them to think about hitting, slapping, whether they witnessed hitting, slapping, shaking, threatening to hit, etc., by the father toward the mother and by the mother toward the father. And we asked whether they experienced this both before the divorce and after the divorce. So to walk you through this, this was our rating scale. They could say, not at all, I didn't see any violence. They could report, I only saw it once before the divorce or once after the divorce, all the way up to daily or almost daily or more than I could even count. So this was the scale, the rating scale. Here's what we find from the young adult reports, that this column here is they reported the frequency at which the father did violence before the divorce towards the mom. This is where the father engaging in violence towards the mom after the divorce. This is mother before and mother after. So what do these bars mean? Well, the average here is 0.82, so it's less than once, all right, across the whole average that father frequency of violence toward mom. But what does that really mean? That means that 28% of dads had at least one act of domestic violence against the mom that the child witnessed and now is reporting as a young adult. So combining, once up to more than I can count, 28% of dads before the divorce. That went down after the divorce. So only 10% of dads were witness to engaged in at least one act of domestic violence toward the mom after the divorce. So that's good news that it went down according to the young adults report. Mother's violence before the divorce toward the father, the mean was 0.41. That meant that 17% of moms were witnessed to have committed an act of domestic violence toward the dad before the divorce. But in this case, it goes up after the divorce. So it goes up to the level that we see in fathers before the divorce. 27% of moms had engaged in an act of domestic violence after the divorce, according to the children's reports. So what we're interested in, given these rates here, we're interested in how this witnessing the violence relates to lingering insecurity about family cohesion, depending on different parenting times. And importantly, we want to see if it's the same pattern that we find for exposure to parent conflict. So let's look first at when fathers committed any domestic violence, that 28% of fathers, towards the mother before the divorce, how much emotional insecurity did their children still carry as young adults? And witnessing the father's violence before this did have a significant impact on emotional insecurity. And we see exactly the same pattern, that witnessing father perpetration of domestic violence toward the mom, if the child was not living with dad at all, it's related to low amounts of insecurity about family cohesion. But when we get up to moderate amounts of parenting time, 10, 20, 30%, we see an increase in lingering emotional insecurity in the young adult. We see the same peak at about 40% parenting time. And again, this seems to be because witnessing dad engage in domestic violence towards mom before the divorce. Now, if the child is having around 35%, 40% parenting time with that dad, that witnessing of the violence has left that child with insecurity about my family continuing to be there for me. Okay? But again, if the child had equal parenting time with both parents, that earlier violence by dad towards mom has left the young adult with less insecurity about my family still continuing to function for me. We see again what seems to be a protective factor regarding this type of emotional insecurity related to conflict and violence. The equal parenting time seems to have protected these young adults from the lingering stress and threat to their physical and mental health by having equal parenting time. When we look at the effect of witnessing mom perpetrating domestic violence against dad, when that happened before the divorce, that was also statistically impactful on long-term emotional insecurity, but we see a very different pattern related to parenting time. So the red line now I'm going to show you on the next graph are the high that's the red line is when the children witnessed the mom's violence toward dad. And we can see that when there was any amount of parenting time with dad, when the mom had perpetrated domestic violence against the dad, these children are left with insecurity about whether this family will continue to cohere and work for me. Pretty much at most levels of parenting time. Why? Because the child's living with mom most of the time. If mom has been violent towards dad, that's a threat to these parents continuing to be able to, be there for me. So since mom is the primary home, the threat to mom leaving or not being able to work with dad for me is there at all levels of parenting time, but it does go down again at equal parenting time. For comparison, I have here the families where the children witness no domestic violence of mom towards dad, and there's more insecurity at every level of parenting time related to witnessing mom engaging in domestic violence, except at equal parenting time. This is not significant difference. So again, when we're looking at the children's witnessing of domestic violence by mom, again, equal parenting time seems to be a protective factor in regard to long-term stress from witnessing that violence. And again, it just seems from all of these patterns of performance that equal parenting time can reassure the child about family cohesion, about not being abandoned, about my parents being able to be there for me as a result of having had equal parenting time, even in cases where there's been some amount of domestic violence and parent conflict. So this is from the child's point of view, looking at how witnessing these things affects the child's cognition and emotional responses and their stress response. So in conclusion, what do we see? I think we see that parent conflict and parent violence work in the same way to threaten children's emotional security about post-divorce family cohesion. With high parent conflict, the threat to cohesion is greatest at 35 to 45% parenting time with dads, because the potential disruption and loss of the family support system would be greater, but equal parenting time seems to provide assurance of post-divorce family cohesion despite the conflict. We see the same pattern that holds for violence by dad before the divorce. With violence by mom before the divorce, the threat to cohesion is high at all levels of parenting time because they're living primarily with mom. But again, equal parenting time provides assurance of post-divorce family cohesion when there was violence by mom. So, of course, an important caveat is that this research is aimed at understanding the psychological processes by which exposure to parent violence affects children. The findings, of course, should not be taken to imply that courts, family law professionals, and policymakers should ignore parent violence when making decisions about equal parenting time. And thank you very much, and I'd be happy to answer questions.
Thank you, Dr. Fabricius. That was excellent, and so much good information around, emotional security for children. My practice, mediation and beyond, that I call it that because it's that beyond piece. So people have a divorce, and then they're left to go off on their way and figure out what they're supposed to do. What I try to do is really follow the families to make sure what they agreed to can actually work, not only for the families, the parents' benefit, but also for the children. So thank you for that. It kind of was validating for me. I'd like to open it up now to any legislators that are still available and here and that would like to ask Dr. Fabricius a question. I know many have had to leave to attend to other duties that they have. So is there anybody from the state legislature that would like to ask Dr. Fabricius a question? If not, I see a hand raised from Joni. You're on your, looks like you're on your iPhone.
Yes, I am. Can you hear me?
Yes, we can. Go ahead.
All right, so my first question is, in the charting, I see, when their kids are not seeing the father at all, or a parent at all, let's say, that it could be because of apathy and lack of compassion and empathy because they don't see that parent at all. Is that a possibility? And the second half of that question being that when we have 50-50 custody, if one parent is difficult, it means that the kids at least get 50% of their time with positive role model. And that may be why it's leveling out, because the one parent levels or balances out the other parent. Is that possible?
Thank you, John.
Sure, I think that's certainly possible. If the child has one secure relationship with one of the parents, that's certainly better than not. We're not entirely sure if having one secure relationship can compensate for an insecure relationship with the other parent, but at least having equal parenting time assures the child that I do matter to some degree to both parents. One parent might be more difficult than the other, but it really seems like equal parenting time reassures the child both that, both parents are committed to me, and that even if they're fighting, that's not going to disrupt my world, because I have a home at both places. When you go 4 or 5 days without seeing one parent, that's when doubts can arise about whether a change is coming, whether dad or mom will show up. But equal parenting time seems to reassure the child.
Thank you. I see Dan, you have your hand up. Thank you, Dan.
So I just want to thank all the presenters for presenting today. It's given me a sense of security knowing that my exact experience that I had here in Connecticut, and this is kind of the legislators, like the experience that these individuals have described overall was my exact experience here in Connecticut. So it goes to show that there is change that we can make in the Connecticut process that would have better outcomes for parents and better outcomes for children. I still don't see my eldest daughter to this day, and I entered the court systems when she was 13 years old, a week after her 13th birthday, and was there on her 18th birthday still fighting, and never lost access, never lost custody, and never saw her again. So, these problems do exist here in Connecticut. So thank you for presenting this information.
Thank you, Dan, and sorry for what you've gone through. So we have Sabo. Can we unmute?
Yes. Hi, everybody. Thank you very much, Dr. Fabricius. My question is that clearly this research is very objective. How far have we gone? Of course, I've seen that. I think you mentioned. I'm based in the UK, so the law is more leaning heavy-handed on men than it is on women. But I've looked at your research, and it appears very objective and meaningful. Of course, you mentioned that it was in one state. You have gone far with the research, and there has been an impact on. Am I correct? Some change in regulation. I mean, how far do you project? And is there any sort of indicative impact that it's had on, being presented in legislature and to have an impact on change of regulation at all, if not in the UK, but in the States?
Well, I think we had some impact in Kentucky, although we weren't directly involved in Kentucky's law. They, from what I understand, they followed the same procedure we did, which was to educate the family law community about the research and have people in the state that people trusted to be presenting the research objectively. I think that's what happened in Kentucky, and it's certainly what we did in Arizona. Since then, we've had a visitor from the Ministry of Justice in Japan come to Arizona to find out how we changed the law there, because Japan is trying to do the same thing. in lots of other countries, Denmark, Ireland, for example, most recently, Canada, and lots of other states. But it is a surprisingly slow process.
So
Not sure why.
so what I understand is you already do have a platform that protect the male victims and your research. You already have a platform in place, not only in America but worldwide, and you have individual members who are looking to reflect that in their respective countries. That's my understanding. Okay, thank you very much, Doctor.
Sure.
Really appreciate your contribution. Thanks.
Thank you, Seppo. Appreciate that. I want to take it right now and take time to thank Professor Hines, Lysova, and Fabricius for 3 outstanding presentations. They couldn't have been more informative and well done. We will now use the remaining time for questions to all our panelists. Respectfully, we recognize that Dr. Hines will need to leave promptly at 3 o'clock. However, we will remain for another few minutes to field any additional questions. I just want to do a wrap up before we do that. The Shared Parenting Council of Connecticut is beyond grateful, like I said, to our panelists for their dedication to their research and for their pertinent and powerful presentations here today. Our state legislators, we have gratitude for their attendance and prioritization of all violence, especially domestic violence and family matters. And to those who participated behind the scenes to facilitate a smooth flow for our symposium, we appreciate you. And lastly, a special thank you to all our audience who took time out of their day to participate. We will linger for a little longer to take some additional questions. If there are any, please again, raise your hand and we can call upon you. Thank you. Is there anybody who has anything else out there? All right, if there's not any further questions, then I think we can kind of wrap. Please view the Shared Parenting Council website at sharedparentingcouncilinc.org. Additionally, please view the Shared Parenting Facebook page and sign up for their newsletter where you can gather significant information regarding the work Shared Parenting is doing throughout the state of Connecticut and actually internationally. Again, thank you for attending the 4th annual Shared Parenting Symposium. Thank you, everybody. A job well done.
Joni actually has a question, I believe.
Yeah, 1, has this been recorded so that we can get a copy of it? 2, can we get copies of the stats and studies? And 3, actually, past intervention is very involved with a huge legislative committee that we're trying to get as many people together as possible to start following and having similar legislation proposed in all states and countries. So anybody who wants to join that just can reach out to us and I'll get you in touch with Deborah Schreffler, who's running it.
Joni, what is that organization again?
P as in Peter, A as in Apple, S as in Sam, intervention. We're the oldest and largest non-501c3 for parental alienation. And if you need to, you can get hold of John to get my info if you can't find me.
You know, I'm over in the chat box right now looking to everyone. So there was a question that came in much earlier in our symposium that said, do we have a definition of what is the best interest of the child? That always comes up. It seems to be a kind of a standard question that comes up. And is there, from the panelists, is there any definitions that you would include in your, I'll go to you, Dr. Fabricius, in your going for 50-50 shared parenting for the best interest of the child? How do you view that?
Well, I view it as promoting the child's optimal development throughout later life. That focuses you on what's important to the child. Too often we take an adult point of view and hear things like, well, children, don't want to, go from one house to the other. Children need one home, one stable place where their toys are, things like that. But when we take the child's point of view, we know from developmental psychology what's important to their future development is the security of their relationship with their parents. So if it comes down to, am I going to be worrying about whether I matter to dad because I only see him every other weekend versus, having to remember to, get on the bus and go to his house on Monday rather than mom's, it's not a question, really. And when you ask the young adults who come through their parents' divorce about the parenting time that they experienced, and they pretty much universally endorse equal parenting time because they know that it maintains their relationship with both parents.
Thank you. Dr. Lysova, there is another question also in the chat that said, that came in from one of our attendees. It says, quote, "My understanding was that parental alienation is an outdated term and the research doesn't support it. How did the research examine the children's perspective on their fathers rather than their father's subjective reports?"
Yes, and I think Denise Hines tried to answer that question further on. There is a great paper published in 2018 by Harmon, Crook, and Denise Hines. So parental alienation is not an outdated term, really. So it's being used right now and seen as a form of family violence. To my understanding, this is an appropriate term to discuss what happens in relation to children when the children are used as a weapon.
Okay, thank you. Maureen, you have a question? If we can unmute Maureen.
Can you hear me?
Yes, we can, Maureen. Thank you. Nice to see you.
Nice to see you. Actually, I just had a question really on the parental alienation issue, that there are groups out there such as Family Access regarding that. But my question is, actually, I wanted to refer back to somebody asking the question of best interest, that there is a statute in Connecticut that actually defines 16 factors so that they're aware of it. It's in 46B-56 subsection C. They can find the actual legal definition for that. And I just wanted to put that out there.
Thank you very much. Do you have a question for anybody, Maureen, while you're on?
My one question would be, I'm seeing, as in Attorney Ashish Joshi's actual recent publication in the Michigan Law Journal in October, his article entitled "Domestic Violence and Parental Alienation, Two Sides of the Same Coin." I see a common thread between the two groups. And I wish that we could coalesce together, and that common thread would be the coercive control aspect of relationships and psychological abuse. And the definition currently be considered by the Connecticut legislators because both groups deal with the psychological component. My question would be this. I think for both camps, it would be helpful if we could take that sword that is commonly used between the two groups, and that would be false allegations, and put in something within the statute and people to consider that as making it a felony that would be, so that there would be some bite to it and be a disincentive for people to use that, whether it be a fine, imprisonment, or some other sort of penalty, such as reversal of custody. So those are things that the legislators can consider, and I think people should consider that, because without any enforcement, I think families and children are suffering from this.
Thank you, Maureen.
Yeah.
Dr. Lysova or Dr. Fabricius, would you like to address that at all?
I was just going to say that we put that into the Arizona law. Pretty good sanctions for not only false allegations, but also false denials. So I could send you that section of the statute if you're interested.
Very helpful.
All right, we have Brian. Can you unmute?
Yes.
There we go.
Hi, thank you. I want to follow up on Dr. Fabricius introduced a new word into my vocabulary on the subject, lingering. And I think that's a great one because I think something that's that is not understood by judges and many others, and it might be an area that I'm going to write on, would be the latency of the effects of the abuse on the children of parental alienation and being raised by a parent who may have a cluster B personality disorder, and that they might be getting A's and B's and captain of the soccer team, but their social and emotional development is severely stunted, and that the judges don't quite comprehend those other aspects of development significantly. And I think that comes out when a child becomes an adult and has difficulty in trusting their intimate partners in future relationships. So with that subject line, if either of the remaining professors or panelists could just build upon my thoughts, validate them, and add any additional thoughts. Thank you.
Brian.
Yeah, I think you're absolutely right. There's much theory and data to show that that's exactly true. These childhood experiences do linger and do have a long-term effect. It can be modified, it can be changed, but the longer it goes on in childhood, the harder it is to sort of reorient that child's system towards trust and security.
Thank you. Thank you,
Dr. Lysova. Do you have anything to add to that?
Just basically to agree. This is what the studies show. Yeah, this is it. Yeah.
Thank you. And we have Edward.
Yes, good afternoon, everyone. Thank you for everyone's presentation. It's all in my heart, 30 years. And I'm located in Bermuda. I've been trying to change the laws ever since the 30 years. Parental alienation and false accusations is a key factors in a lot of situations concerning men and fathers. The family courts, where it's a little different than elsewhere, our family courts only deal with enforcement of child support here. Most of it, when you're married, you go to the Supreme Court. But it's much needed to change in respect to parental alienation and this allegations of abuse. I've been in many organizations in Bermuda and overseas, and and it's very hurtful to fathers when they stacked against, everything's stacked against them, and they don't have nowhere to turn. And then they come to us looking for answers, and we can't give them because the law does not enforce these type of situations and help them sort out their custody issues.
Question for us, Edward?
Pardon me?
You have a question for us, just so we can make sure we're timely and can get other people in?
I apologize. Okay. My question is, I would like to have as much research as possible, if it may be, so that we could, give to our legislators so that they can implement. We've been promised about 6 times in our throne speech, but nothing hard hitting that's really come forward with that. Can any information, any research be available to implement the shared parenting? And I thank Dr. Fabricius in his presentation of implementing in Arizona and helping Kentucky. Thank you.
Thank you, Edward.
Feel free to contact me, send me an email, and I can send you whatever you need.
Thank you so much.
Sure.
Thank you. Can we unmute?
Yes.
There we go.
Yeah, I'm unmuted. Okay, thank you very much, all representatives, for very good material presented. I'm representing NGO from Slovenia. I have a question. So we experience in Slovenia that divorce processes are taking years before they are resolved. Resolved meaning who gets custody, etc., etc. We believe that the cause for long-lasting divorces are lawyers, because longer it takes on court, more money they can generate. Does anybody has any opinion about that? Thank you.
Thank you, Istak. Dr. Lysova, do you have an opinion or?
Yeah, it's a very good question. It's not for the first time I hear this question about the lawyers and their role in the process. And in my individual communication with some people and some victims, that question was brought up. Unfortunately, I haven't seen any studies that would look into this, but I think it is a very, very important issue to look into. So it's something that I'll keep in my mind.
Thank you. Dr. Fabricius, do you have anything to add?
Yeah, there was initially resistance by the Bar Association in Arizona, but over time and hearing the research, we had their support. I would again encourage anybody to talk to some family law people in Arizona. I know the lawyers and the judges talk about we still have to individualize with equal parenting time. The lawyers talk about having to, educate the parents and still work with them. I really have not heard that it has, negatively impacted the Bar Association, the Family Law Bar Association in Arizona having this law.
Okay, it's good news.
Yeah. I mean, think about it. Only 5% of cases really go through court. Those are really the problematic cases. And lawyers are still involved with those people, even though we have an equal parenting time presumption. So I think maybe the lawyers worry that they'll lose their profession, lose their business, but I haven't heard that that's happened in Arizona. So
and I just have one
question. With these families differently.
Thank you. I just have one question I want to get in because and then we'll have to shut it down. But what are the researchers doing to make themselves available to testify as experts in these court cases? Are researchers available or drawn upon to come into court when you to testify?
I do occasionally.
Okay.
I don't really advertise it. I'm very busy with research, but maybe 3 to 5 times a year.
Okay.
I will. I like to do it because it lets me see what's really happening out there in the real world.
Good point.
Yeah, the researchers do that. Yes.
Okay, they do that. Thank you. Anybody else before we close? We're exactly on 3:15, this is a good time. Thank you, Dr. Lysova and Dr. Fabricius for staying extra to answer the questions that our attendees had. And thank you for coming on today. Thank you for sharing your knowledge and your time and your research. And we look forward to hopefully continuing to work together. So thank you from the Shared Parenting Symposium. Thanks everyone for coming to the 4th annual, and we will see you next year.